Alrighty, so something I've been wanting to do for quite a while now. We are going to go through 100 of the different responses from nurses for their best and worst interactions with doctors. I'm excited to see what they have to say because there are some great things that doctors do, but there are some not so great things that doctors do. So let's weigh it all up. Let's see their responses. There's going to be a mixture of text responses, audio only, and then a few video responses in there. So I asked them a few months ago what they reckon their best and worst interactions were with doctors.
Okay, so this one's for all the nurses out there. I want to know what is the best and the worst interaction that you've had with doctors working at the hospital. Or it doesn't have to be at the hospital, wherever, but from a nurse's point of view, what is the best and worst interaction that you've had with a doctor? I'd be really interested to hear what you guys have got to say.
I'm very excited, but also very apprehensive because I'm not sure what half the responses are. I've looked at a few of them. Some of them are very interesting. Some of them are definitely shocking. So let's get into it. All right, there are 100 responses here. We're going to break it up into a few different parts. So let's jump into the first one. I think it's an audio response.
Worst interaction, but it's kind of funny, so it's kind of like a compliment from a doctor. But anyways, I was a student nurse and I was in theatre and plastics, and a surgeon and I were working together, and she basically said to me that you're so intelligent, I think you should become a doctor. And I was sitting there in my head, I thought, that's a great compliment, but also, what's wrong with being a nurse? So I responded and I was like, that's such a lovely compliment, but what's wrong with being a nurse? And then honestly, she literally went all red and pale and I felt really bad, but I was just genuinely curious. And she said, oh, no, nothing, but I think you'd make a great surgeon, which was nice, but yeah.
Yeah, that's like such a big misconception, right? Like, not all the smartest people have to be doctors. You can have like very intelligent nurses or physios or pharmacists or whatever allied health professional you want to be, or some other part of medicine or healthcare. You don't just need to be a doctor if you think you are the smartest person or you are the smartest person. There are a range of different specialties in medicine that you can do. And I don't think all doctors are the smartest people ever. So it's just breaking a misconception, breaking that stereotype.
Nice, but yeah, I would say that's pretty funny. I don't know, best experience. I think the best experiences with doctors is when you work as a team and you're not seen as gum under their shoe. You know what I mean? I think the hardest thing in hospitals is politics and you're not being seen for your value. But when you get a doctor that's like really understanding and really wants to work with you, then obviously patient care and patient outcome is so much better. So I'd say that's the best thing, when you have that doctor who's willing to work with you and as a team.
Yeah, could not agree more. I mean, when everyone combines into one team looking after the patient, your job gets easier, the patient outcomes get easier, the day just runs like much more smoothly. So as soon as you realize that the nurses can help you, the physios can help you, and then vice versa, you can actually help the nurses do their job better, communicate a plan, etc. It just flows much better and everything just works out if you work part of a team. So could not agree more with that one. Number 2.
I'm a psych nurse and my best interaction was with a new consultant who would always ask me how my patient had been doing that day before they took that patient in for a consultant review. This consultant would frequently check in with the nursing staff and the contact nurse for the shift and make sure that they were on top of our experiences with that patient that day. They would ask us questions, be really validating of our assessments.
Yeah, that's like so true. And like as soon as you walk in, you should, before you see the patient, check on the nurse to see how the patient is actually doing, because they've spent the most amount of time with the patient, most likely. And even if they're just starting the shift, they might have a general impression of how the patient's going, what they look like, did they do anything differently or weird, or was there anything handed over from the night shift? So get the nurse's assessment. They can be super helpful in guiding your clinical decision making for the patient for that day.
And would really take a lot of lead from our assessments. My worst experience with a doctor was also on this same psych unit that I was working on, where it was like 10 to 5 in the evening and this consultant had some bad news to give a patient, and instead of waiting until the next day to tell them. He went in without telling any of the nursing staff what was happening or what he was about to do, and told this patient some really horrible news, and then left. And when he was leaving, he was like, "Oh, this person's really upset, but I've got to go now." And he left the unit, and this poor patient was quite distressed and became really dysregulated and upset. And it felt to the nursing staff like this consultant had just sort of like dropped a bomb and then just disappeared with no communication to the team of like.
Yeah, you need to like communicate those big changes in the decision making for the patient, and if it changes their clinical trajectory, you need to like communicate that to the rest of the team. There's no point making a big decision and then not involving everyone else, because then they might think they're going down this way, but it's completely like done a U-turn and gone the other way. And I mean, just something as simple as delivering bad news. Sure, they might not have had to wait till the next day to do it. You might have had to do it on that same day. I think that's reasonable, but doing it in a manner which is appropriate for the patient, and then being able to just communicate that to at least one person so they know what to expect when they walk in would be super helpful. Yeah, it's not the best, but I think there are definitely more worse experiences to come. Number 3 is a text response. Let's get this up. Okay, so number 3 says, "I'm a new grad nurse working in theatre and have had my fair share of interactions with doctors. I'd say my best interactions with doctors would be the explanation of what is happening during the surgery, so I have a better understanding of what instruments might be needed before the surgeon asks for them." Yeah, and that comes like with experience, right? Like, you can't just like guide people through every single step of the case all the time, but over time and your bits and pieces, you might explain something, say what you're doing, why you're doing it, and then you actually get to predict. And I know, as a junior doctor, watching the surgeries and over again, you see the same operation, and then you learn how to predict what's going to happen, what tool you're going to need next. And then when you start doing like small parts of the operation, then you can actually learn and think like that. So yeah, that's super important, but it does take time. The worst interactions would be when something minor doesn't go a surgeon's way and they were not happy and almost packed a tantrum and threw a couple of instruments across the room. Yeah, that's insane. I've heard of that happening like a few different times, but I've never actually seen it in real life. It is a little bit childish and definitely not the best way to respond to anything that's happening in the operating room, no matter what it is. But I think everyone can agree on that. Maybe the instrument that they got was the wrong one that they requested. Maybe they just, I don't know, it didn't work or it broke or something like that. But rather than, chucking a tantrum and throwing the instruments across the room, I think there's a much better way of going about it. So yeah, that is a tricky place to be in. I think the operating room definitely changes personalities though. So it's a very high pressure, hyper intense environment, and it's, it brings out the best qualities of people, but also the worst. So it's an interesting place to be in, but hopefully, operations going smoothly, it all goes well, people keep their cool, but in the high pressure situations, people need to, see how they interact and how that affects other people. All right, number 4, I'm a new grad and there are heaps of new residents. Every time I have needed a review or asked a question, they're so happy to come and help, and also so honest when they don't know something. I feel like because we're both new in the area, there's a mutual understanding, which makes me feel less annoying. And the worst, with no bad experiences yet, all the doctors on my ward are amazing. Yeah, wow, that's super good feedback. I think that when you're new and lost and equally as clueless at the start of the year or at the start of your career as a doctor or a nurse, it is so reassuring to have someone who's in the same boat with you, because you're well, I'm gonna have your back, you're gonna have my back, we're gonna figure this stuff out together, and then ask people for help all the time. It is a interesting place to be. It's not most comfortable I've ever been at the start of my career, but having that support to know that other people are in the same boat is reassuring, I think. So yeah, that's super good feedback. And it looks like your doctors on the ward are super nice. So that's definitely not the case for every single ward, but I'm glad that you've had that experience. That's awesome. This one says, the best is when we get supported and work together. The worst is when we don't, and doctors treat nurses like they have no idea what we're talking about. It's rough in peds as most doctors come from adults and treat us pretty poorly with a huge attitude. Then they realize kids are pretty scary, and if you don't work with the nurses, you are left to fend for yourself with cannulas and other procedures. But majority are okay. Thumbs up. Yeah, I couldn't agree with that more. When doing procedures for kids, you need to have everyone on side, like the doctors, the nurses, the parents. I could think of like numerous times, like I've only done peds as a student, as a medical student, and yeah, I think it was like second or third year, and we had one person who was like operating YouTube and playing like some like cartoon or Bluey or something like that. We had the parents sort of like trying to distract the child as well, and then the other nurses or other medical students like helping like hold the child down so that you could pop in a drip, or maybe it's like just examine their belly or something like that. So all those things take a lot of people, a lot of distraction and a lot of support. So if you have to do that yourself, you just have to do it once and realize how tricky it is. So make sure you treat everyone kindly so you can get all the help you can do. I think that is the best way to go about it. All right, moving on to number 6. So the best, this person has a lot to say, which is good. So the doctor stopping and giving me a med check when there were no other nurses around. Can't say I've ever done that. I didn't know we could give med checks, but I guess you can. Yeah, I've never done that. So that's really good. Engaging well, asking how your day is, and having a normal convo makes you respect them more and understand that they are just human, like the rest of us. Only certain doctors are like this and are well respected and liked by the nurses. One doctor even sat down and spoke to us nurses about their degree at uni and placements, etc., and life outside of work. I was shocked at the amount of respect that doctor gained by the nurses due to the strong human connection made. Yeah, that's insane. I mean, I don't know why they started talking about their degree at uni, but it's good to realize that, you know, you can just have a conversation with other people at work, whether it be like the ward clerk or the patient or the PSA or the person like, you know, handing out lunches to the patients. I mean, you can just talk to people like a normal person. They don't have to be like segregated by like their role at the hospital. They also say doctor asking the nurse for their opinion and recommendations when an RN may have called for a review shows that the MO respects the nurse and makes you feel like a valued team member, considering you're the one with the consistent eyes on the patient. Yeah, couldn't agree more. Like, this is so important, as I said earlier. Ask the nurse what their opinion is, what they think, because they've seen the patient for a longer period of time. We're not like with the patients 24/7. The nurses are constantly looking at them, watching them, observing them, helping them out, doing their medications, etc. So if you don't have their point of view involved, I think you're missing a massive part of the clinical assessment. And the last thing they say is the doctor actually acknowledging you as the nurse when you're at the bedside next to the patient and the doctor is doing the rounds. They may even ask, are you happy with everything, etc., rather than storming out. Better communication and safer patient care and outcomes. You know, that's like a good thing like for you as well as a doctor. Like if you want them to do something as part of the plan, make sure they understand it. Otherwise the plan is going to be like not executed. So if they need hourly urine outputs, then make sure you communicate that. And if you want something to change, then you just have to ask them to, and ask them nicely, and make sure that communication is clear. Otherwise it doesn't like work and your plan doesn't get executed and the nurses are frustrated and the patient doesn't know what to do, and it's all like just a mishmash. So make sure you clearly communicate what you want to do with the patient. All right, and then they say the worst thing was they were abused for calling an AH reg. Not sure what an AH reg is, but they were abused for calling them on the phone, even though that patient is under their service, leading myself as a nurse to cry when I was a junior. Just doctors being plain rude and abrupt when engaging with them about the patient under their service. Sorry, can't think of a certain situation, as unfortunately this is a common occurrence. That is kind of sad to hear because, you know, you shouldn't be abused for calling about a patient if you're worried about them, if you need a review for them, if you have any questions at all. Your job is to escalate as a nurse. And I think that, you know, I don't know, like you shouldn't be abusing anyone at work, regardless if it's a doctor to a nurse to a doctor, you know, other allied health or other clerical staff. You know, no one should have to go through this at work. And yeah, that's like a bad experience to have as a junior because you may like get left with a different experience or a different impression of what a doctor is like. So it's probably like an extension of the environment that they're in, which is a little bit frustrating to see, because maybe it's like high pressure or high stress, or maybe some other job didn't get done or whatever, and then they take it out on you because that's the easiest target. So not an excuse, maybe slightly an explanation, but definitely not a great experience to go through. The worst was doctors dismissing concerns, and then we had to call a MET call, upgraded to a code blue, and she said, "Oh, the nurses never told me." Yeah, that is straight up lying and horrendous, which is bad, bad, bad. So I don't know what to say about this. I mean, you should, take the nurses' concerns or, escalation points seriously. Obviously, you can't get to everything on time in the hospital. It's a very busy place. There are lots of jobs to do. But if you can't get there, then send someone else, or let the nurses know, or whoever's escalated to you, that you are coming, you are busy, you are aware. If it's a MET call, of course you have to come urgently. And if it's a code blue, then obviously you have to respond way more urgently. So yeah, just saying, "Oh, the nurses never told me," is pretty dismal on that doctor's behalf, to be honest. The best was, though, that they had 2 docs that had a double rotation of the hospital at night, and they would help with everything. Need a spinal log roll? No worries, here to help. Need to give a wash or change of a pad for a combative patient? They are reviewing, no worries. Yeah, that's insane. For a combative patient, I've never helped out with a wash or changed. I think I've changed maybe 1 pad, potentially. But yeah, that is outrageously great from that doctor, or those 2 doctors, to be honest. Being an orthopedic ward, we had a lot of older patients who had dementia and cognitive impairments, and they would come review combative patients instantly, and also not afraid to call the med reg for some assistance. Yeah, that is super good. It sounds like these docs are absolute winners, to be honest. And yeah, sure, I've helped out with a spinal log roll. I've helped maybe change or, move patients around, but have never given them a wash. That is out of this way. So that's really nice from those 2 doctors. I couldn't think of any 2 doctors that I'd rather have on a night shift with me. So that's really, really good to hear, to be honest. Number 8 is an audio one.
Hi, my name is Riley. I'm a grad nurse. So I've only been doing this for a couple of months now, but I've already had some great and not so good interactions with doctors so far. Probably the best one I've had is a surgeon coming in to talk to one of their patients who was my patient as well. And then at the end of the interaction, the patient asked if they could have some water. And normally a lot of doctors will just come grab a nurse to get them some water or ice chips or something like that. But it was just really nice to see the doctor be like, of course I can get you a glass of water. And she went and got the patient a glass of water, which...
Yeah, that is surprising sometimes. I've had a busy surgical ward round one time, and the consultants come on it, and then, they rapidly reviewing all these patients, and then they do something as simple as that. And it just takes you aback, because you think, oh, you're constantly in this fast paced, super urgent, super rushed environment that you need to get to theatre or clinic or whatever it is. But then they stop and just I don't know, pass them their phone that's on charge that they can't reach, or give them water, or make sure their tray comes back. I mean, you should do that. It's not oh, they're amazing people for doing that, but sometimes you forget it because you're such in a rush and you're so focused on doing whatever you need to do for the day. So yeah, it is quite nice to hear that.
It was just a little bit of time out of her day, because I know that doctors are very busy sometimes, but it was just nice to see that kind of humility, I guess, that sometimes you guys don't have time for. The worst thing that has probably happened was I noticed a change in my patient's neurological state. And so I paged the team, and one of the interns came in and berated me for paging her, and just for a kind of a multitude of reasons, just not enough information, and just bits and pieces here and there. And I was right, there was a change in neurological state, but it just happened to be during a special lunch that the medical team had going on, and I just got made feel absolutely terrible for trying to advocate for my patient.
Yeah, you shouldn't have to feel like that. I mean, if you are concerned about a patient, no matter if there's a lunch on, there's a clinic on, you're in the operating theatre, if you are worried about someone, you escalate, and your job is to escalate, and that you've done the right thing. So that's not great from that doctor's point of view to just berate you and say that you shouldn't do that or busy or whatever. I mean, if someone has somewhere to be, then you need to, delegate the task to someone else, or delegate the phone for someone else, or the pager, or whatever it is that you use to answer calls or, receive messages about your patients with. So definitely I used to, delegate that when interns are teaching. So when I was on a rotation and there was interns, there was residents, the interns would have like their teaching on like one day, and then as soon as their teaching started, I'd say, give me your pager, I'll hold it, and then you can get it when you come back. So that's just one way of avoiding that situation, because, patients don't stop for your schedule in the hospital. You have to constantly, be aware of the patient. So yeah, that is not great to hear, to be honest.
And like I fully understand that I was interrupting something, but it made me question everything because I'm only a few weeks in.
Yeah, there's like, especially when you're only a few weeks in as a grad, like, don't worry about it. Just realize that that's an extension of that own person's state of mind and not something that you're doing. So yeah, it's kind of hard to pull yourself back out of that situation, but that's the advice that I would give if you had that happen to you. All right, number 9 is a video, our first video response, which is exciting.
Hi, so my worst interaction with a doctor was I was an RN in a tertiary ED and went up to the doctor wanting a review of the patient's medication that I questioned, because this patient had come in the night before, had a subdural hematoma, got discharged, left on some Panadine 4 and came back the next day with a worsening headache despite the Panadine 4 that they discharged him. She said, no, he's drug seeking, he's an IVD, we're not giving him any more pain relief. And I said, well, he hasn't had any pain relief here and he's complaining of a severe headache. I think we should give him something. She's like, give him the tramadol that we've written up. And I was like, well, that's what I'm questioning. I don't think he can have the tramadol because he's got a small subdural, his headache's getting worse, and he's taken all of the Panadine 4. So not only do I don't think we do not need the tramadol, I think we also need to do a Panadol serum, because he could possibly have overdosed on the Panadine 4, because he's had the whole box apparently within 24 hours with just 20 tablets, and he had had further Panadol from a chemist. When she said, why would we listen to you, you're just a nurse, in front of like all of doctors or nurses.
That is like probably one of the worst things to say, like, you're just this or you're just that. It's so like patronizing, it's so condescending. So often, like, I mean, I used to say it about myself, like, oh, I'm just a medical student. And then people would be like, no, you're not just a medical student. You're like, you're part of the team. And you're like, nah, like, I'm just a medical student. But like, people who are like, oh, you're just a nurse and put other people down, I feel like that's something we need to stomp out, because that is, it's not a great look, and it's not like the way we actually see people, even though that comes across like that. So yeah.
And I was pretty much like, I'll take the Panadol serum and we'll get that back, and I'm not giving him tramadol, so I'll just document that you're refusing to give him any further analgesia. I don't really mind anything else. Panadol came back and he did a NAC infusion. This doctor then went to the consultant and pretty much said that she initiated all these things and da-da-da. So yeah, that was that. And then my best
yeah, that is not great. It's sort of like that other one that we saw where, the nurses try to escalate and then the doctor was like, oh, the nurses didn't tell me anything. So you don't want to get grilled in front of your colleagues, especially your senior colleagues, but that doesn't, mean you can put other people down in order to make yourself look better or whatever. So yeah, that is, not a great look from that doctor.
Best interaction with a doctor was probably I was running a code in rural and remote where there's no doctors, it's just me and another nurse. Had to thrombolize a patient with tenecteplase, and they praised on how well I'd run the code. So praise and also faults in some.
That's insane. Like, that is a massive thing to do as a doctor, nurse, or whoever you are. If you're running a code by yourself or with another nurse or just one other person, that's a very, very stressful thing to do. So taking control in that environment and making clear decisions and, debriefing after and realizing that you've done a massive job is an amazing achievement. So that's kind of a redeeming thing. But, getting that feedback from doctors after that, after you've done a good job, is really good. And it doesn't have to be a doctor giving you feedback, it's anyone in the healthcare space. Okay, so they say for number 10, Not sure what stories you are after, but here's something I thought of that may not be the best stories ever, but I have a few of each. I'll think of more. All right, well, thanks so much for giving a response for this. There is a lot here. Let's go through them. So the best would be a new doctor just started at my hospital working in ED and ordered an enema for a patient who was constipated. I got it ready and then he said, "Can I do the fleet enema and you watch and teach me how to do?" Yeah, I was in shock for a doctor wanting to learn from me as an enrolled nurse. So, I mean, I think doctors don't do a lot of stuff that nurses would do, and they need to learn how it works, how long it takes to set up, even if it's something like, starting an IV or whatever. I mean, there are a lot of different steps that have to happen before that actual plan, that actual, thing that you want done can happen. So it does take time, but if you actually just hang around and, I saw a medical student the other day, hanging around with the pathology nurse, the phlebotomist, and they go around and take bloods from every patient and, just hang around with them, practicing your cannulas, practicing your venipunctures. You can actually learn a whole lot about how that actual system works. So I think probably, we should enact something like this, as medical students or in medical school, where we are actually, following or shadowing a whole lot of other professions, not just doctors in the hospital, because it would give us so much more insight into how it works. Maybe it's shadow a physio for a day or shadow a pharmacist for the day. And then you're like, oh, this is how long it takes to get a script ready. Or this is how long it takes to actually assess a patient for a physio assessment. So stuff like that could be super, super valuable for doctors and medical students. We had another doctor ask me if I could teach him how to prime an IV fluid line with the IV fluids and work the IV pump with me letting him do it and teach him. So all shift I got him to prime each line he wanted. That is really good. Yeah, I think that's super nice for the doctor to learn and get so much out of the shift. It's not just doing your job and telling people what to do. But for the nurse, it's a good that, you can have someone to help them and work with them, and it's not just you doing it all yourself. So it's a best of both worlds, I think. The worst was a doctor yelling in a PPH, so a postpartum hemorrhage. Then she bent over to do a speculum. I was holding the torch and the midwife came and moved the torch and hit the doctor in the head. That's crazy. I guess that happens in a high pressure, highly tense environment. So, accidentally things like that can happen. I don't know, I've never been in much PPH situations, only as a medical student, I think maybe once or twice. So that is interesting to say the least. Another one doctor I've known for a long time who knows my name, in an emergency pointed at me and said, "You get the suction." The point and then said, "You get the suction." It must have been an urgent deteriorating patient, but that is not the best way to address someone and ask them to do something. Then ever since, he's called me my name and been so nice to me, even asked how I am coming onto the night shifts. So that's really good to hear. Obviously they didn't do the best thing in that highly intense, high pressure emergency situation. But yeah, I guess that is a reflection of the environment, as I said before, rather than your interaction with them as a person. I think once you get into that situation, emotions flare up, you just need to get stuff done, you're worried about the patient, and sometimes you can just let your mouth run a little bit and do stuff like this, which is definitely not appropriate, but I guess it's, part and parcel with some situations if urgent stuff needs to happen, which is not an excuse, but more an explanation as to why it probably happened, even though I wasn't there. So yeah, that's kind of interesting, but really good to see how they've turned around. And then they also said one doctor kicked a wall and pretty sure left a hole in the wall due to no cannulas in the IV trolley. That's insane. I don't think I've ever heard of someone kicking a wall if there was no equipment or something went wrong, but that is a little bit ridiculous and a bit childlike, right? What are they doing? Just go somewhere else. Just go somewhere else to find the cannulas in the IV trolley. There's obviously a shortage of the cannulas or whatever equipment that you need. There's no real reason to kick a wall and enact like that. So yeah, that is not the greatest response to that situation, but there you go. So we've done 10 of these responses from nurses who are commenting about their best and worst interactions with doctors. There's a whole bunch more. We have 100 in total to get through. There are a mixture of text responses, also some video responses, and a few audio responses in there as well. There's been some great responses so far with doctors, and then there's been some not so great interactions with doctors from nurses. So we'll just have to see what's to come, and hopefully there's some good experiences that make up for all this bad stuff, you know, that they talk about. So let's wait and see. We'll go on to part 2 next. But for now, we'll see you next time. Bye.